Did you know every second person in India who's pre-diabetic doesn't even know about it? And what's worse is that almost half of them will end up having diabetes in the next 5 years. And once that happens, life becomes a lot harder. I've seen patients dealing with heart disease, stroke, and leg artery blockages, all thanks to diabetes and pre-diabetes. And many of them have ignored the early signs of pre-diabetes. But here's the thing, pre-diabetes is like a warning bell. You can listen to it and get things sorted out in time. So what exactly is pre-diabetes? Pre-diabetes is like a warning sign towards diabetes. When your blood sugar levels are high, but not as high as they can be called as diabetes, that sign is pre-diabetes. Think of it like a speedometer. Your car is going at 80 and the allowed speed is 100. But even if you are not careful at 80, you are likely to crash. In numbers, this means a blood sugar level which is between 100 to 120 or an HbA1c which is between 5.7 and 6.5. So this is a short range where prediabetes can be really defined. If it goes beyond that, officially you become a diabetic. But the problem is that most people try to be more careful only when they have diabetes. The real challenge is to pick up prediabetes and don't allow yourself to become a diabetic. So which are the symptoms that you should look out for in case you or your colleague or friend or relative may have prediabetes? There are a few small hints that your body can give you. The first is feeling of tiredness even after a good night's sleep. The second symptom may be being unusually thirsty and having to pee very often. The third may be just blurry vision or tingling and numbness in your hands and feet. The fourth may be cuts or wounds that take long time to heal. And the fifth one, an important one, is development of black patches on the skin, especially in the neck or back. This in medical terms is called as acanthosis nigricans. So if you notice any of these symptoms, get yourself checked. You might be a pre-diabetic. Now coming to causes, why does pre-diabetes happen? The main culprit doctors believe is lifestyle. So by lifestyle, we mean a combination of diet, physical activity, stresses, everything. So to break them up, diet has a very important role to play. A diet which is rich in carbohydrates, especially simple carbohydrates and sugar, can often lead to prediabetes. On top of that, people who have less physical activity, who are glued to their desks and have to be sitting for long hours of time without any physical activity of exercise, are likely to end up with weight gain and prediabetes. And the third major factor is stress. Stress releases a lot of stress hormones, including cortisol, which also can in turn raise your sugar levels. You may have heard that India has become the diabetic capital of the world. And according to the Indian Council of Medical Research, there are almost 100 million people who are living with diabetes in India. But what is even more concerning to know is that around 130 million people may be pre-diabetic and most may not even know about it. And it's not just older people that I'm talking about. It is younger, relatively fit or seemingly healthy people in their 20s, 30s and 40s who are being diagnosed more and more frequently with pre-diabetes. So, pre-diabetes is not an old age problem, it's a lifestyle problem. So now, how to really reverse pre-diabetes? That is the key question that we all would be worried about. Reversing pre-diabetes is simple, but you need to be consistent in doing certain things. Just focus on these three key areas: diet, exercise, and sleep. So when you fix your diet, you reduce your overall carb intake, reduce your sugar intake, and also include a lot of healthy fats and proteins in your diet. I'm sure your pre-diabetes will come back to normal within some short time. And here's a tip. Don't try to go for crash diets. It will come back in time. Aim for small steps which can be sustained over the longer term. The second step is to stay active. Even simple physical activity like walking, running, jogging, swimming, cycling, they all are perfectly fine. Aim for 30 minutes per day for 5 times a week, and your body will really thank you for this. And a small tip for those who want to be physically active: keep a track of your steps. Put your own aim. Don't go for 10,000. Start with 5,000 a day, go up to 6,000 a day. Be consistent and regular in that. Then you may aim for 10,000 steps a day. And the third important task for all of you is to reduce your stress and improve your sleep. Most people ignore sleep, but it has an important role to play in your sugar metabolism. Poor sleep also increases your stress hormone cortisol, which in turn will cause insulin resistance, and hence the sugar levels go up. So make sure that you have at least 7 to 8 hours of peaceful sleep every single night. If you don't have any of these symptoms, should you really get tested? If you have a family history of diabetes or prediabetes, or even if you have any one of the symptoms that I mentioned, please get yourself tested. It is better to detect a problem in time rather than wait for a problem to become bigger. A fasting blood sugar test and an HbA1c are the two main tests that you require for a diagnosis of prediabetes. And even if your tests are normal, get yourself tested at least once in a year. This applies to everybody above the age of 30 years. So coming to a few myths about prediabetes that many have asked us. The first is that I don't have diabetes, so I am okay to eat sweets. Remember, excess of sugar consumption is now a known risk factor to develop prediabetes, if not diabetes. So keep your sugar and simple carb intake low and do not overfeed your body with too many carbs. The second myth is that only overweight people get prediabetes. Yes, obesity is a definite risk factor for prediabetes, but there are many people who are thin and they do not have the right physical activity who will still end up getting prediabetes. So obesity alone is never a marker of prediabetes. And the third myth, a worrying one, is that if I have prediabetes, I will surely get diabetes. No. Prediabetes is preventable, very much reversible, and if you are careful enough, you may not reach to the stage of diabetes. So remember the bottom line: prevention is better than cure, because diabetes itself does not have any major cure. And if you're wondering what problems diabetes and sugar can cause to your circulatory health, this podcast we've discussed all such problems that can happen because of diabetes.